All right. How is everybody? Welcome. Welcome back. Um, so, a quick reminder be sure to check if I left a comment on your discussion boards. So, by the time you get to the discussion boards, you've, you know, done the reading questions, read or viewed a lecture on those questions. Made corrections, and then you get to the board. You're ready to kind of give some arguments and thoughts. So if you get to the board and I put some comments down to the effect that you're way off, then you really need to either email me some questions about things you're confused about, review the lecture if you haven't actually consumed it yet, either in verbal or written form, all that good stuff. My comments, I apologize that they're a little terse. I have a lot to get through, so I just kind of like give feedback, and if it comes across as a little harsh, that's not really intended. I'm just trying to give you an accurate picture of how you're doing on those posts. And of course, I always have office hours, which are listed on the syllabus and online. So if you ever want to come hash some stuff out, then that is highly encouraged. I'm located, of course, on the Prescott campus. Alrighty then. Last week, we discussed the issue of paternalism, and paternalism has to do with the degree to which it is permissible for doctors and other healthcare workers to make decisions on behalf of patients. So by last week, I kind of have in mind the Dworkin article where he goes over Mill's argument. Um, so again, paternalism, when, if ever, is a healthcare worker allowed to make decisions on behalf of patients for their own good, even though these patients, or perhaps a representative, such as a family member if the patient is incompetent for some reason. So even though these patients are capable of deciding what treatment options to pursue or reject, when can the doctor basically, if ever, overrule them, ignore them, so on and so forth, for their own good, presumably. Hence, a discussion of paternalism involves this issue. Sorry for the redundancy. This issue of should the doctor ever ignore the patient's express wishes for his or her own good? Now, this week, we're also going to be considering the general issue of paternalism, but it's going to be more focused on cases in medicine as opposed to in law generally. And we're going to look at two rather interesting real-life cases, the Wangley case, and then, of course, the Bouvia versus Supreme Court. Okay. Our first article from Robert Schwartz is a discussion of the right of physicians to refuse treatment to patients whom desire that treatment. So again, this is one dimension of paternalistic decision-making. Schwartz distinguishes between two reasons for refusing medical treatment. One is futility. Schwartz thinks it is obvious that physicians, I don't know what a fission is, but physicians don't have to offer a treatment which does not work, even if the patient wants that treatment. Hence, to use his example, a doctor would not have to prescribe or recommend pasque flower tea to a patient with cancer, since there is no evidence that this would actually help the patient. Another reason for denying treatment concerns the purpose of medicine. Schwartz begins the article with a discussion of someone who wants their arm amputated for religious reasons. Schwartz argues that since doctors are only trained to do procedures which are medically necessary, and since this procedure is not medically necessary, the doctor has the right and perhaps even the duty to refrain from amputating. It is with this second reason for denying treatment that the Schwartz article focuses on. So he's going to kind of camp out on this issue of whether or not a treatment fits within the goals of medicine. And he's trying to create some wiggle room for doctors to reject having to give a treatment if it doesn't meet a proper aim or goal of giving medical treatment. And he's distinguishing this issue from issues surrounding futility. So there's a difference between refusing a treatment to a patient because it just isn't going to work. That's a futility justification. Or for refusing a medicine because it doesn't serve a medical purpose. So again, if someone just happens to want their arm amputated, let's say for religious reasons, doesn't mean a doctor has to go through with it because it doesn't really promote the health or well-being of the patient. All right, so now let's look at a specific case, the Wangley case. Helen Wangley was an 87-year-old woman who suffered severe brain damage and slipped into a persistent vegetative state after suffering a heart attack. In a persistent vegetative state, the patient has no higher order brain function, but can be kept alive through the use of technological help such as feeding tubes and ventilators. Such a person is not technically dead, but they are not at all conscious and they engage in no thinking or perceiving of the world or themselves. Mrs. Wangley was on a ventilator which breathed for her, and she was being fed through a feeding tube. After several months of this, the doctors thought that keeping her alive like this was medically inappropriate. They thought that being kept alive this way was no longer a reasonable medical alternative. Nobody, in fact, has ever regained consciousness from such a deep coma, and the doctors knew that Helga would not either. Now, the Wangley family objected. They viewed removing Helga from the machines as tantamount to murder. They also thought that only God could legitimately make such a decision. Hence, to use, sorry, my computer did something funny, so let me, okay, so let me start again, sorry, with the family's objection. The family objected. They thought pulling her off the machine was tantamount to murder. They also thought this was not a decision that was appropriate for people to make. They were deeply religious. Furthermore, they testified that this would have been Helga's view also if she were capable of speaking for herself. Hence, they viewed themselves as the best spokespersons on behalf of Helga's desires. Question 1C asks, in what ways the doctor's desire to remove Helga from the feeding tube would be a violation of her and her family's autonomy? The answer is probably pretty obvious. The family knew what Helga would have wanted because they knew her value system. They also knew she would have wanted to stay connected to the machines. Hence, they were exercising Helga's right to autonomy by insisting that the treatments continue, and the doctors were trying to overrule this decision because they thought that keeping a person alive in a persistent vegetative state was not a legitimate goal of medicine. So, to put a little flesh on those bones, if you're just keeping someone alive in this non-conscious state, no healing's taking place, there's really no chance of recovery. You're literally just kind of keeping their body alive for the sake of keeping it alive. The person is gone. So any kind of higher order personality traits, intelligence, emotion, willing, believing, doubting, perceiving, all that's gone. So the doctors reasoned, there's no point to this. There's simply no good reason to keep her alive. The point of medicine is to do things like relieve suffering, try to bring about cure, even partial cure, but none of those goals could be met. Okay, moving along. What would a utilitarian say about such a case? So that this pertains to question 1D in your reading questions. What arguments could a utilitarian give in favor of ending the treatment? Well, for one thing, this treatment was very expensive. Her hospitalization was paid for by Medicare and a private insurance company. Hence, money was taken from the overall pool of money, which we reserve by various means to treat people's illnesses. Now, even if she has, of course, private insurance, insurance companies have to decide what to cover, what not to cover. Of course, people who buy the insurance, they kind of want all kinds of things covered, even if there's just a small chance it'll be effective. But to keep everybody's premiums at a reasonable level, the insurance company really does have to make some choices about what gets covered and what doesn't. So the utilitarian could argue, look, if we decide corporately, us including the insurance companies, to cover such treatments, then some other treatment which has much greater benefits for the patient is not going to get covered. So that would be a strong reason from a utilitarian perspective to not pursue this treatment. So the fact that other important treatments would not get covered would be one bad consequence of this course of action. Having said that, a utilitarian would also pay close attention to the grief caused to her family if they went against her priorly spoken desires. Hence, it is at least possible a utilitarian, especially an act utilitarian, would accept keeping her alive. A rule utilitarian most certainly would not, given the expenses. And if you really think this through, it's probably the case that the family's going to suffer no matter what happens here. So if they keep her alive, they kind of know she's on life support, and that can be kind of traumatic. If they pull the plug, maybe they feel a little guilty for going against their wishes. That can be traumatic. The utilitarian has to, in order to apply the principle of utility, has to have some way of kind of calculating those consequences. And that's actually a weakness in the utilitarian approach, is it's often, practically speaking, impossible to do. So you get these kind of gray area cases when you just don't know what side, which option, which choice, which course of action would produce the best overall consequences. Okay, so let's look at the court's decision. The court actually ruled in favor of the Wangley family on the grounds that they were in the best position to carry out whatever wishes Helga had or would have had given her overall value system. In other words, the court was only concerned with the patient's autonomy and ensuring that Helga received the care she most likely would have wanted. So, of course, the court kind of ignored any kind of utilitarian calculation. They really just wanted to go with what Helga most likely would have desired. Now, in regards to questions 2A and B, Schwartz disagreed with the court's decision because he thought they focused on the wrong issue. Schwartz does not think that patients have the right to treatments which go beyond the purpose of medicine. Notice he doesn't object to the treatment on the grounds that it is futile. That's what the original defendants tried to do. This is because the goal of the treatment was simply to keep Helga alive as long as possible, and it was actually succeeding at that. What this treatment could not accomplish is restoring Helga to even minimal consciousness. Hence, this raises the question of whether the goal of keeping someone alive in a vegetative state should be a goal of medicine. In Schwartz, he actually goes about answering this question indirectly. Schwartz argues that doctors are the ones who are in the best position to determine what is medically appropriate and what treatments fall outside the scope of medicine. Most doctors care about their patients' well-being, and they know more about what the goals of medicine should be than the average person in the street. Doctors will disagree amongst themselves concerning a variety of issues. Schwartz thinks that this makes his suggestion that doctors should get to decide even more plausible. This is because a treatment will be available to a patient if any doctor they have access to is willing to provide that treatment. If no doctors will provide a treatment, then it is quite likely that the treatment is misguided. So this is just kind of like a common practice approach to determining what the goals of medicine are and what they're not. So again, to recap, if all the doctors pretty much that a person has access to refuse to give a particular treatment, then that's actually a strong indicator, if all the professionals are kind of agreeing, that this is not an appropriate treatment to pursue. And again, Schwartz thinks that makes his suggestion more plausible, because if even one doctor is willing to offer the treatment, then the patient is going to get it. So that respects autonomy to a high degree. But if there's this unanimous consensus that the treatment just shouldn't be given, it's outside the goals of medicine, then only under those conditions will the treatment not be given. Okay. Now let's evaluate this suggestion. Is Schwartz right? Figuring out the goals of medicine is more a question of moral values than it is a question involving specific medical skills. So this is a criticism of Schwartz's approach. Hence, you might think that the average person in the street is just as capable as the average doctor in determining whether or not a procedure is appropriate. Then again, you might not. This will actually be this week's discussion board question. So, look forward to that. So do you think Schwartz is right? Do doctors have the sort of training which gives them kind of an inside perspective on whether or not a certain treatment's appropriate? Or does this kind of value-based decision-making, does that not really rely on the sort of technical medical training a doctor receives? So just to do an analogy, so let's say you were an engineer. You'd be very good at knowing how to build a bridge, so on and so forth, but that wouldn't necessarily make you an expert on whether or not the bridge should be built in the first place. So let's say there's like a city and a city planning committee, and someone in that kind of public administration position. Now they're the ones who have some training in kind of looking at, should we build the bridge, or maybe a library, or a park, or something like that. Again, the engineer, they want to consult the engineer to find out the costs and everything. But the general values question, is it more important to the city to have the library or the bridge? That's not a question that the engineer receives any specific training in. They only receive the technical training in how to go about building the best bridge. Similarly, you might think in the Wangley case, the doctors, they have great technical training on how to go about attempting various cures and treatments, but that doesn't make them experts on whether or not a treatment is appropriate to begin with, at least in this sort of case where we're dealing with this kind of general question about the value of keeping someone alive even though they're not conscious. What about a doctor's training would give them insight into whether such a life is worth preserving? It seems like you and I know just as much as the doctor does about what such a life would be like or not like, since it doesn't involve consciousness. So it's not obvious, is what I'm getting at, that the doctor's technical training gives them any special insights into this more values-based question and whether or not it's appropriate to pull the plug on Wangley. Okay, so again, just food for thought. You get to kind of interact with that issue on this week's discussion board. Okay, now we're going to look at patient autonomy and paternalism from the opposite angle. Just as a patient might want a treatment a doctor is unwilling to provide, a patient might also want to reject a treatment that a doctor wants to give the patient. So Elizabeth Bouvia was in just such a situation. So at the time, Elizabeth was a 28-year-old woman who suffered from cerebral palsy, and she was also quadriplegic. Even though her physical body was in ruins, her mind was sharp. It is worth noting that she was in a lot of pain most of the time, and her family had decided they could not care for her. So at the time the court brief was written, Elizabeth was at a public hospital in Los Angeles, and she could not eat enough food, being spoon-fed due to nausea and vomiting. Hence, she was put on a feeding tube against her wishes. So Elizabeth preferred to starve instead of receiving treatment in the form of a feeding tube. Now, the case raises a number of issues. First, does refusing a feeding tube when you can't eat enough food the natural way constitute an attempt at suicide? You might think it does, since Elizabeth knows that refusing the treatment will result in her starving or perhaps dehydrating to death. If you view her decision in this manner, then you are forced to consider whether or not suicide is ever morally permissible. Do all mentally competent adults have the right to take their lives? Do only those experiencing great suffering have such a right? Or does nobody have such a right? So again, if you think we should view Bouvia's decision as a form of suicide, then we're led to consider this question: when, if ever, is suicide morally appropriate? But you could also view her decision differently. You might think it is the disease which is killing her, since it has already prevented her from eating and drinking sufficiently the natural way or the normal way. Refusing treatment is simply accepting the fact that the disease will soon end your life, but this is not really suicide, since you are not actively killing yourself by, say, using poison. This is also a plausible way to view the case. And then, if we view it this way, this raises the question: is deliberately letting a disease kill you any different, morally speaking, from actively taking your own life? This question is rather hard to answer. What do you think? Looking ahead to next week, your first essay assignment will one of the options is to kind of interact with the Bouvia case and kind of render a verdict and argue for for your view. So that's kind of coming up, looking ahead. Okay, now let's look at a parallel case in order to kind of shed light on this issue of whether or not refusing to eat through a feeding tube is classifiable as suicide, or if it's simply letting the disease kind of take its course. Okay, so here's the parallel case. Many persons who have cancer, they refuse chemotherapy even when it is likely to extend their lives for a few years. The reason for this is that chemo is a deadly toxin which ravages the body and causes great pain and suffering. Many cancer patients prefer to let the disease kill them sooner instead of undergoing chemo and perhaps likely living considerably longer. How does such a patient's decision compare with Bouvia's desire to reject her own treatment? Now notice that most people don't think that cancer patients who choose this path are committing suicide. What is different, if anything, about Bouvia's case? If you think a cancer patient can make a proper choice to reject chemotherapy, must you also think it is proper for Bouvia to resist treatment for similar reasons? Thinking about parallel cases is a great tool for gaining clarity on specific moral issues, as the comparisons often reveal inconsistencies in our initial judgments, which then forces us to rethink our views. I suspect that many of you who think Bouvia should be forced to receive food and water, if any of you think this, have a different view of the cancer case. If this has happened to you, you should rethink both cases. Okay, now, I'm actually not going to lecture on the last two questions, since they were designed to get you to state your own judgments on the case. And another reason I'm not going to lecture on it is because, looking ahead to next week, your first essay assignment will be on this Bouvia case. So next week, when I'm looking at what you've come up with in regards to your analysis of the case, I'll be responding to your rough drafts and that sort of thing. So that's all coming up. So, okay. So we've covered what we needed to cover. And yeah, email me any questions, thoughts, comments. Take the discussion board seriously, do the best you can. Because when I look at that, it helps me get a very clear sense of how you're doing with the material after you've read the lecture, done the reading questions, so on and so forth. So by giving you feedback on that, I can let you know if you're kind of getting it, kind of not yet, so on and so forth. So that, again, it's all designed to be helpful. All right, till we talk again. Bye-bye.